Hello everyone, this is Dr. Saurabh Dixit, your surgery faculty at Allen. So today we have a patient of ventral hernia, and I thought before operating that patient I should make a clinical video for you all. So what is a ventral hernia? It's a very simple thing, that it is hernia arising from the ventral part of the abdominal wall. Now when we talk about the ventral part of the abdominal wall, there are 2-3 things that we need to understand. Now when we talk about this ventral wall, this is the entire ventral wall that we have. But this is again divided into the midline zone as well as the lateral zone. So hernia from xiphi up to the pubic symphysis, anywhere along this line will be known as midline hernias. But there has to be a lateral, you can say, border for that. So the rectus muscle. So between the two rectus muscle and from xiphi to the pubic symphysis, the hernia that you have is known as a ventral hernia, midline category. Now lateral to this muscle, so this is the lateral wall hernia. Now when we talk about these hernias, how do we segregate? Remember, European Hernia Society classification is very important, and it further classifies the midline hernias into M1, M2, M3, M4, M5. So from the xiphi to 3 centimeter below the xiphi, that is known as subxiphoid or M1. From this 3 centimeter below the xiphi sternum up to 3 centimeter above the umbilicus, this is known as M2, which is known as epigastric hernia. Remember, epigastric hernia is also known as a scarless hernia. Then remember, when we talk about this hernia, that is something which is 3 centimeter above the umbilicus, 3 centimeter below the umbilicus. What is this? This is known as a ventral hernia. So ventral that is the M3, that is umbilical hernia basically. So 3 centimeter above, 3 centimeter below the umbilicus. Now 3 centimeter below the umbilicus up to 3 centimeter above, that is M4, that is infraumbilical, and then we have below the infraumbilical up to the pubic symphysis, we have suprapubic or M5. Now let us see this right and left subcostal planes. So below the subcostal plane up to 3 centimeter above the umbilicus and lateral to the rectus. So just see this domain below the right subcostal, 3 centimeter above the umbilicus and lateral to the rectus. This is what is the area which is known as subcostal. So this is L1. Now above the umbilicus 3 centimeter below the umbilicus and lateral to this rectus, this area is known as a flank hernia, that is L2. Then we have the third one, that is above the iliac crest, lateral to this, that is known as L3, that is your iliac hernia. Yeah, and then we have anterior axillary line lateral to this portion, we have L4, that is the lumbar hernia. So this was a crisp review of the European hernia guidelines. Now this is what is a classical umbilical hernia, and if you see, this is an irreducible type. So it is irreducible type, and the content of this is probably an omentum. So omental fat is there, bowel is not there. However, you will auscultate, you will examine, and then when very important thing is that you will always look at the skin changes. So here if you see, the skin has been, what students, the skin has been thinned out. So this patient is now prepared for this IPOM surgery. So I have planned intraperitoneal only mesh repair. So what is intraperitoneal only mesh repair? I will go for a Palmer's axis. So here we go for a Palmer's axis. I will make a left subcostal port and 2 ipsilateral ports. So I will show them in the surgery. So this is how we access, and then via harmonics and via a special composite mesh and tackers, I will be doing a primary repair. Along with that, the mesh repair for this patient. So students, we are very thankful to these patients who actually devote themselves for you. These patients come up voluntarily. I always ask them that I want to make a video for the students, for the doctors, and they're very, you can say, overwhelmed with that proposal. And one thing that we need to understand, we need to respect our patients, because today, because of our patients, we are here and we learn with these patients only. So hats off to everyone. Do subscribe to my channel and do like my video. Comment in the comment section what you liked and what more clinical videos you want.